Thank you. It's an honor to be here, and we appreciate all of you guys taking the time to come out here to be with us. I'm going to have to use my notes because I'm a little nervous, but I do know our story. ARCHway was founded back in 2013 when we were suffering from an addiction problem with one of our children, who is now working on his 14th year in recovery. We didn't know where to turn for help. Our traditional network of church, who was willing to pray for us, and our medical doctor, who didn't do addiction medicine, and the EAP programs through Dan's business offered a couple of sessions with therapists, but we needed more. And finally, it was a peer and a peer family who took us by the hand to help guide us through the system of recovery, and that's how we got started with all of this. It was our son's vision to give back to those that he saw needed a second chance and had burned all their bridges with family or friends, and so we were willing to help support him on his journey back. And that experience became the foundation of ARCHway. And as Matt said, we help families find information, resources, connect them to professionals. And it just seems clearer and clearer that peers and peer families are key to finding that.
So the key one there for our journey with our family was, it was peers. It was a peer who came and told us we had a problem in our family. It was a peer member who came and guided us through the system, and it was a peer who helped us lead us beyond into recovery from stabilization. So peers are the key in our experience. And so ARCHway, we just modeled it. We basically, our mission is we became a peer family. What we do is we basically put out we're open for business time by telling our story, and then people come and ask us for help. They come and they ask us for help. We cry with them first, and then we will get them in touch with peer families, peer support specialists. We will give them some coaching, and we will connect them to treatment centers, recovery houses, and the professionals who take it from there. But here's the big picture that I think we all should know. Over 1/3 of U.S. families are dealing with a loved one in their family that has an addiction problem. I've heard actually the number, I read some data that said it's actually 47%. So it's someplace between 1/3 to 40%. A lot of people, a lot of families are dealing with this. Between 10 to 17% of the people over the age of 13 are actively struggling with either a drug and or alcohol addiction. That's a big number. That's 48 million people in the U.S. who are actively using, and their addiction is active. And to be honest, that's the group ARCHway goes after. Now, we can't help 48 million people, but that's the group we're going after. Because only 20% of those people ever ask for professional help. Only 20% of the people who are actively using ever ask for help. And before I say why they don't ask for help, here's the good news. Here's what motivates us. The latest data would say 75% of those who do ask for help, professional help, find long-term recovery. There may be relapses, but they will ultimately. So if we can get them to help, then there's some great chance that they will find long-term recovery. So our goal is to raise the number from 20% asking for help to a higher number. But here's the three main reasons people don't ask for help. Denial. They don't have a problem. They've convinced themselves they don't have a problem. Stigma. Fear for what their family will say, what their employer will say, what their friends will say. And financial barriers. By the time they might ask for help, they probably burnt every bridge and they don't have the money to get the help they're asking for. So those are the three main barriers. There's a whole list more, but those are the three, and that's what ARCHway goes to try and tackle. We do it through education, going out in the community, telling our story, telling people they're not alone, and education to reduce stigma, get people to ask for help. Visibility, again, we were very visible in the community, trying to show people, they're, just like Matt said, he's in long-term recovery. People want to emulate and find and be, and have that same story. And then we also provide peer support, free peer support, and also provide scholarships. Typically our scholarships are $500. Right now, it used to be to cover deductibles at a treatment center. Things have changed in that world in 13 years. Most of our money now goes to cover first month's rent at a recovery house, and to get somebody up and running. So that's it. We are a grassroots organization, and we're proud of it. About 80% of our funding comes from families and individuals. And we do that strategically and on purpose because we do want to get out in the community, talk to people, and make sure we keep focused on getting people to come and ask us for help. ARCHway right now, it's unbelievable. We raise some for us. We raise now about $750,000 a year. With that $750,000 a year, we provide free peer guidance to people. So when people come and ask us, can we help them, we say anything we do for you is free. We will help you find help anywhere in the country. We do develop educational materials in all sorts of manners, social media, everybody learns in a different way. And so we provide that. And this year, now looks like we're going to give $125,000 in grants and scholarships, typically at the $500 level, which Jan and I are proud because 13 years ago when we started, we gave two $500 ones, and guess who paid for it? Now the question we had as a strategic group was, how do we emulate what we wanted to do without having a staff and a call staff of thousands and thousands of people? Because we were a grassroots. And that's why as a board we decided to go with the National Peer Recovery Alliance. And if you really look at it, you listen to our story, who helped us? It turned out helped our son was somebody in long-term recovery, was a waitress and came up to our table like today and whispered in our ear, I need to talk to you, your son has a problem. And then it was a bartender. After 5 years of going through how he says, I know you've been through the mill, let me help you walk through the system in St. Louis. And then it was another family who grabbed it. So it was always the peers. So what we said to emulate this, and Matt said that they're the first to show up and they're the last to leave, people in long-term recovery, was we need to put our money against developing peers. It may not grow the ARCHway brand. We don't care about that. What we want to do is support peers and get them out, give them as much tools and support as we can, and get them out in every place around the community so they can not only be great employees, but they can also be great coaches and drive other people into aspirin recovery. And that's that. I've got two last things. And then Jan will close it, is we are, and I don't have to do that because Matt covered it, we're very excited. This whole thing of teaming up with Ohio Department of Mental Health and Addictive Services to help develop peers. You can understand why this is near and dear to our heart. And also, it's the first time we've really gotten a grant that we worked on. But we have total alignment in what we're trying to do, and we're very excited about that. And then Jane and I are also very excited about the panel discussion today. And I just want to give you a little lived experience. I worked 34 years at Energizer as both plant engineer on the plant floor, then I was in charge of technology, then I was in charge of new business development for Energizer. So I had a 34-year experience of working in the business world and the production world. And then after that was over, I had 13 years of running ARCHway and growing ARCHway and living in the recovery world and the addiction world. And I will tell you, if I were starting a business today, I would seek out people in long-term recovery, and I would hire them. I wouldn't do it as a community service. I wouldn't even view it as a second chance service. I would do it because it was a great business decision. And the reason is, what have we learned in our 13 years that I would have liked in my business world? People in long-term recovery have at least three traits that you would love to have in your business. Resilience. They know how to face challenges and how to deal with it. Accountability to themselves, family, and coworkers. And the third one is gratitude and loyalty. They don't take opportunities for granted. They're grateful for them, and they will be there. They're great. They're the kind of traits that you would want in your business. The other thing I would do is I would start a business. I also register as an Ohio Recovery Friendly Workplace. It's like turning on an open sign each morning to your business. And what I would say, it's not that you're just friendly there, it's the other employees that aren't dealing with this, the lucky ones. I'll call them the lucky ones. But you're sending a message to them. You're sending a message to the outside world. It's just, I talk about it, you're visible, you're being visible about your support. I would then specifically hire or provide access to a peer support specialist. Because again, 1/3 of your employees are probably struggling with this, and those folks as caregivers are probably under more stress, we can attest to that, than the people that are actively using. And those peers can be very helpful to your entire staff. And then I would employ people in long-term recovery, again, not as charity or as a second chance. I just think it's a great, smart business move for us to look at this. Okay, just say thanks.
Sorry, and the time's flying. Just real quick, I do want to say, because I talked to somebody earlier who didn't quite get what the ARCH and ARCHway means, but the A stands for awareness around stigma that's in the disease, and R is we believe in recovery, and C, it takes a community, and we do need to work together and be aware of that. And H, the health, it's mental and physical health, and so you need to tie all that together. Thank you very much. We appreciate all your being here.